So I am super excited to chat with Dr. Jen Pfleghaar as we are going to be talking about peptides and, of course, relating them to thyroid health. So let me go ahead and dive into Dr. Jen's bio here. Dr. Jen Pfleghaar is a double board certified physician in integrative medicine and emergency medicine. She attended medical school at Lake Erie College of Osteopathic Medicine. She then went on to residency at St. Vincent's Mercy Medical Center for emergency medicine and spent 1 year flying with Life Flight as a flight physician. Dr. Jen now works at local emergency rooms in a community and her office in Perrysburg, Ohio, practicing integrative medicine and medical aesthetics. She is a graduate from the University of Arizona Andrew Weil Center for Integrative Medicine's fellowship program. Dr. Jen loves speaking and lectures to physicians at conferences, including the American Osteopathic Association, and she hosts a podcast, the Integrative Health Podcast with Dr. Jen. Her own health history of Hashimoto's, which is now in remission, sparked her interest in integrative medicine, and she is very passionate about helping patients with chronic disease and teaching them now to let the body heal itself. She is a published author of the book Eat, Sleep, Move, Breathe, A Beginner's Guide to a Healthy Lifestyle, and she is a board member for Invisible Disabilities Association. Her hobbies include spending time with her husband and 4 children, being in nature, weightlifting, wake surfing on the Maumee River, and reading the Bible. And thank you so much for joining us, Dr. Jen.
Hi, thank you, Dr. Eric. So nice to be here.
Yeah, really, again, excited about this. And yeah, that background. So you are 1 year flying as a flight physician. So that sounds, is it as exciting as it sounds?
Yeah, it was really fun. And whenever I see Life Flight fly over, the helicopter, I think back of the days where I put on that jumpsuit and you come out of the helicopter and you just walk towards danger and help people out. And it is a lot of fun because you're there to fix what they can't fix and to get people to where they need to be to trauma centers. So we would like stop in the middle of the highway and stuff. Pretty cool flying with really talented pilots. My life was in their hands. So probably wouldn't do it anymore now that I have a bunch of kids. But
Yeah.
it was a really fun time in my career.
Yeah, definitely sounds like it. And so we're going to be chatting about peptides. And so before we get started, can you talk about how did you start learning about peptides? And, of course, at the end, we'll talk about your peptide summit, which definitely recommend for people to attend. But yeah, how long have you been working with peptides and what led you to start recommending them to your patients?
Yeah. So about probably 2018, I started to look into peptides and I was like, what are these? People are using them, they're working well. And then I kind of got cold feet for about like 6 months because we had heard that the FDA was going to kind of take them away. And I was like, oh, I don't want to learn this whole new language, right? Because as we dive into the names of these peptides, it's like a different language, a lot of alphabet soup going on. So I got a little bit of cold feet. And then I joined this peptide group and on Facebook, and one of my colleagues, Dr. Rose, runs it. And I'm like, okay, that's it. I'm digging into peptides. I'm going to get some education on them. I'm going to start using them. I'm going to start talking to the compounding pharmacists about them. And I was just so happy I did because it just levels up some of the struggles that patients have, getting from to like that extra 10% of wellness. Or if it's a really sick patient and they're doing all the things they can, sometimes it just moves the needle a little bit for them. So it's been really great to bring it into practice. And, it's still kind of, if you're listening out there, if you look up peptides, I mean, it's kind of a gray area right now. The FDA just put 22 more peptides on this class 2 list for pharmacies. So compounding pharmacies aren't making certain peptides that we were so used to having. Most of these are the injectable forms. So we're kind of in a weird area right now with peptides. But the good news is that we're going to talk about there's a lot of oral peptides that we can take, and they're looked at more as nutraceuticals and supplements. So those aren't going to go away. So that's the good news.
Yeah, that is good news. Unfortunate about some of the injectables, and it sounds like not all of them. You said 22 specifically, and I know that could change in the future.
Yeah. And the definition of peptide. So people listening, they're like, what is a peptide? Now, there have been some big names out there that have recently done podcasts and YouTubes on peptides. So let's go over the definition. Peptides are chains of amino acids, usually about 4 to about 50 amino acids. When you get higher than that, then you get proteins. Okay. So we have these little amino acids. And then if it's 4 to 50, it's a peptide. And then greater than that, it's a protein. And then less than 4, technically these are called more like bioregulators. So 4 or less amino acids, you get into that bioregulator phase. So with peptides, people are like, oh, peptides, and they're starting to get this like weird name or biohacking name. No, we have peptides in our body naturally. Insulin is a peptide. Oxytocin, which is the love hormone, which, breastfeeding women need, that's a peptide. So when we're getting dramatic, talking about peptides, no, we make them in our bodies. And the peptides that we're talking about today, most of them are found naturally in our body also.
Yeah, well, thank you for that explanation, and let's just dive into like some of the benefits of peptides. Like then, why, like especially this audience consists of people with thyroid and autoimmune thyroid conditions. So why would those listening to this be interested in using peptides to improve their health?
Yeah. So what these peptides to do is they go in to your body, whether you take them intranasally, injection, orally, and they turn on and off genes in the body. So it's not like they're going in there like medication and disrupting things or forcing different pathways and having side effects. They're working with your body, turning on and off genes, which is pretty amazing. And that's why I love peptides so much, because they have pretty good safety profiles. Some of them you have to be careful with certain things going on, but most of them are very safe. And if we look at the studies, most studies are in animal studies. And the reason for that is it's really hard to get clinical trials done. They cost a lot of money. Usually they are funded by drug companies. And these peptides are really hard to patent. Now, some of them they're starting to patent and they're turning them into actual drugs. And one example of that is thymosin alpha 1. So, thymosin alpha 1 is a thymic peptide. And what our thymus is, it sits about here on the chest, and it is an organ that is really good for our immune system. It really is going to modulate immune health in our immune system. And this is something that goes away as we age. And these thymus peptides are really good at modulating our immune system. And thymosin alpha 1 is one of the ones that is amazing for autoimmune diseases. It was also in many studies. You can look them up on PubMed with COVID-19 and thymosin alpha 1. They were using it a lot in China in the hospitals there. And the patients were getting thymosin alpha 1 when they tested positive, and they were getting it injected daily, and they were doing really well. That was a great one when we could still get it in the US to use for autoimmune diseases like Hashimoto's, for COVID-19, which was an immune dysregulation and dysfunction when those cytokine storm would take over. And that's when people would really get sick. So thymosin alpha 1 was one of them that I think it was about 2 years ago, the FDA said no more. Compounding pharmacies can't make this anymore. And it was really frustrating for a lot of us that were using it. And our patients were doing really well with autoimmune diseases. And it was helping them get better faster, to go in remission faster. And then, like I said, also like COVID-19, it was helping. And unfortunately, it's hard to get now. And now it's a biological, like it's a biologic pharmaceutical. And I think it's about like 20,000 a month or something like that.
Wow.
Yeah, yeah. So it's a little frustrating. That was kind of the first step that happened, like with the FDA, how they're classifying some of these peptides. Now, though, it's now some creators, Kent Hortoff, Dr. Kent Hortoff is one of them. They took the thymosin alpha 1 and made Thymogen, which is an oral peptide, and that is going to have some of that thymus response too. So that's what I've been using in my patients with autoimmunity issues going on. When I think it's the right time to use it, I will give them the Thymogen, and that will help. It's not as good as what we used to have, but it's still helpful. So that's, when we talk about peptides, we're just trying to use what we have available right now. And the doctors that are out there using peptides, we're really just trying to go with the flow, not be discouraged of the ones that we can't use, and just look forward to what we can use and how to work them into our patients' protocols. So are you using peptides currently in your practice?
Uh, as of now, no. As of
Okay.
now, I'm not using them, and it's this is the first episode where we're focusing on peptides. I have had some others where they talk about peptides along with other things, but this episode is just focusing on it. But with the previous episodes, they would talk about thymosin alpha 1 as an option. So that's why also it's been a while since I had anybody talk about peptides. It's something where probably I should have, you or someone else come on like once a year, because it sounds like it's evolving, and hopefully the
Yeah.
thymogen will be available, for the foreseeable future. But you never know, or maybe something else will come along that's better.
Exactly. And along with the thymus peptides, there's also thymosin beta 4, and that was injectable. So those were kind of used together. A lot of people use that for repair, so cellular repair. And like a lot of athletes use that. And then also, immunity, it's a thymus peptide, autoimmunity. Now, that one, same thing, can't really get it injectable. So now there's something called TB4 frag. So it's a fragment of that thymosin beta 4, and it's oral also. And that is another one for autoimmunity, which is really helpful and to calm everything down. So a lot of those, there are some oral peptide companies that put those two together, the thymosin and the TB4 frag. So those would kind of be a really good regimen to someone that I like to be aggressive with new onset Hashimoto's, when we really have just discovered it, to try to put it in remission really quickly. So then maybe they don't have as much damage to their thyroid gland, but also in those hard chronic cases where maybe there's all those other layers, maybe like Lyme. Lyme would be a good one that those two peptides would help, because it's really focusing on that immune system and rebuilding that. So that's some of the ways that you could just use, the oral ones. And yeah, it's sad that we don't have the injectables, but we're kind of just moving forward with technology, and the oral peptides, they actually do really well, and not everyone likes to give themselves shots. So I find that it's a little bit easier for patients, even though some patients do get pill fatigue too, but it's a little bit easier.
Yeah. So with the thymosin and a TB4 frag, they could be used for any autoimmune condition, as far as you know. Like, are there any autoimmune conditions that they shouldn't be used for?
Yeah, I mean, you're not using them long term. That's another thing with peptides. You're going to cycle them. Okay. You don't want to just be on the same peptide all the time, right? You don't really want that. You want to cycle them. You want to work with someone that knows how to cycle them. So that one, usually for about 3 months, and see what happens, and then reassess. And I usually have patients take a break after 2 to 3 months and see what's going on. Now, another favorite peptide that is also a good peptide for thyroid, Hashimoto's, Graves, all those autoimmune diseases, Crohn's. There's actually a lot of studies with BPC 157 and Crohn's. So BPC 157, body protection compound, it's actually made in our gastric juices. That's actually how it was discovered during those Pavlov dog, experiments. So it was found, this BPC 157, and it is very, very good when you take it orally for healing the gut, healing gastric ulcers, Crohn's, irritable bowel syndrome, anything with inflammation. BPC 157 is great. It's also great for tendon healing, tendons, ligaments, and that's the injectable BPC 157. There will be some anecdotal, now that we can just take it oral. That's another one. We don't have the injection available anymore, that they say it still helps with their tendons when they take it orally. But I found the injection works a little bit better when it's closer to the site of injury. I know, like my left shoulder, I had an injury and I could not lift. I could not do shoulder presses. And now it's healed. And I use BPC 157 to help heal and repair it, especially, as we're aging. But I've also had patients that have had really like chronic pain in their joints from playing football in high school. And we put them on 2 months of BPC 157, kind of cycled it, and they were able to get out of bed and they were feeling a lot better. So it's a great peptide. Interestingly enough, it is banned by like the NFL and, all of those professional sports, which I think's interesting because I don't know how you would test for it. That maybe there is a drug screen for BPC 157 that I don't know about, but a great peptide that, I've spoken with orthopedic doctors that were more conventional, and they're like, yeah, I don't know what that is. And I'm like, well, right, of course you don't, because what's your goal as a surgeon? It's to go to surgery, not to avoid surgery. So that's why I think a lot of these, if they were used consistently by all of medicine, it would probably make people really well and would cut back on hospital stays, surgeries, all of that. So BPC 157, that one is available to take orally, 500 milligrams once a day. Great for gut health. Like I said, sometimes it's paired with lorazepam, which is another peptide, but it's also a pharmaceutical it helps with gut health and to repair the gut lining, those tight junctions, and also modulates zonulin a little bit. So that I've seen in combination with BPC 157. And I've had patients that have had chronic diarrhea, Crohn's, all of these horrible GI things, recovering from GI viruses, illnesses, really recover well with the BPC 157. And I always keep it with me when I'm traveling because you never know if you're going to get like food poisoning or a virus somewhere. So that's a good one to take with you when you're traveling too.
How about with H. pylori and or parasites? Can that be beneficial at all?
Yeah, I think it would help with inflammation, but I don't think it's really going to take care of the H. pylori. You know what I mean? Or the parasites.
It's not an antimicrobial, in other words.
Right. That would be like LL37, which that one is injectable, and that one we can't get right now. That was a great antimicrobial, anti-candida. That one was injectable and really hard cases. That one I would pull out as like a big gun. A few human studies on that one also, LL37. Back to BPC 157. So this is what I talk about. It's like a different language, but BPC 157, if you write that one down, that one I feel like is talked about a lot. It also could be compounded into eye drops. You can put it into wound cream. I've compounded it for a patient with a really bad scar wound that he was at the misfortune of a couple urgent care visits where they totally messed him up. And he's like, I have this big wound now. So we got him on some BPC 157 and GHK copper peptide cream, and it healed beautifully. So BPC 157 can be in they can make it in all these compounds, and the eye drops were really cool. Some studies with like corneal healing on that. And I've had patients with dry eyes. One patient had dry eyes post chemotherapy, and the BPC 157 was the best thing that had ever worked for him. So the downsides, it's the eye drops are really expensive to get compounded. I feel like those were a little pricey.
Now, you said that with the BPC 157, there was another, I think it's an injectable peptide you could take along with it that can help with gut healing. Can you also take the BPC 157 with the TB4 frag or thymosin, or is that something you'd want to cycle where you'd go back and forth between the two every few months?
Yeah, you can stack them, but then you'd also want to take a break and cycle too. And it kind of depends on the patient in front of you too. So say someone comes in, I mean, I usually start with gut health. Like I will usually look at their symptoms, maybe look at their GI effects or their stool study or their organic acids test if they have mold or candida, and I will tailor it to that and their symptoms too. If they're having a lot of gut inflammatory symptoms like diarrhea, bloating, pain, we might want to just change their diet first to make sure they're getting sleep. And, we might want to add on a peptide. So sometimes I look at it, I talk to them about it. I'm like, here's all the things we can do. What can they afford and what are they comfortable doing? Sometimes I will remove, like if there's an H. pylori or parasites I'm worried about, or candida or small intestinal bacterial overgrowth, we'll take care of that first and then layer in peptides in there, like the BPC 157. And then after we fix their gut, then I usually do the thymosin and the TB4 frag after that. And peptides, they do work better when you're optimized. Okay. So say someone just they're a mess and they're not willing to work on anything. And if you throw some peptides at them, they might not, they might be like, oh, this isn't doing anything. And they spent all this money. So I have noticed, like, once you optimize a patient a little bit more, then add on the peptides, it's like icing on that cake, and they work so well. And these are basic things like nutrition and sleep and stress. So, I never want patients to waste money, obviously, because these kind of things aren't covered by insurance, but they work well. So, optimizing those things and then adding on peptides a little bit later onto therapy sometimes is good, unless they're in like a crisis and you just want to throw the kitchen sink at them, or while you're waiting for test results. It wouldn't hurt while waiting for their stool study to put them on BPC 157 and calm things down. Another good peptide for inflammation is KPV. And this is actually a part of alpha melanocyte stimulating hormone, MSH. So this one is great because it's so good for inflammation. And this will be the one that's paired with the BPC 157, and it will just add another of calming inflammation down. I love this product for mold patients. Really helpful. They're often low in alpha melanocyte stimulating hormone anyway because of all the Marcans, and this will be really helpful with them. I've had some patients where giving this intranasally, they really liked it that way. They felt like it really calmed down the inflammation, like in their head that they felt. But you can also take it orally. I like to take this every once in a while if I'm feeling like more inflamed. Sometimes I take it with PEA just to help with inflammation too. But KVP is a great one. Really like that. And like I said, mold patients. I mean, I've had some mold patients that they'll stay on that for a couple months at a time, and then we'll take a little break and they might go back on it. So I really like that one. And with your autoimmune patients, thyroid, Graves, of course, that's going to help a lot too. And usually these patients are the ones that have underlying mold going on. In your area, do you see a lot? Where are you at again, Dr. Eric? What part of
North
the
Carolina.
country? Oh, yeah. So you probably see a decent amount of mold, right?
Yeah, I mean, it's definitely seems like it's increasing. I mean, part of it also, I'm more aware of it, and compared to, I can't say I
Yeah.
test everybody for mold, but whereas like maybe 5, 6, 7 years ago, I wasn't doing urinary mycotoxin testing at all. Now,
Right.
I'll more aware of the situation, and we'll do that if necessary. Have them test the house for molds. So,
Yeah.
but I think it's I've, even though I'm in North Carolina, also work a lot with people from all over the
Virtual.
place.
Yeah.
And yeah, exactly. And so I don't think there's only any place that's safe from mold. More places some places will be more susceptible, but I'm sure you see people even in places where you wouldn't suspect mold, where there might be cases of mold.
Yeah. And I also feel like just building material now is so cheap, and it's just, it's just cardboard. It's all mold food. So you have one little leak, one drip, slow drip, and then mold. And it happened. I'm so paranoid about mold because of what I see in my office. And last Christmas we were out of town, and like there was like kind of like a freeze, and one of our pipes burst, and the water went like down to our basement, and it had been about 24 hours since it had happened, because we looked at like the water like use charge. It was like tons and tons of gallons. But I was like freaking out to my husband. I'm like, it all needs out, like right now, right now. And everyone thought I was being really like a little crazy, like, oh, here, she's being crazy again. And I'm like, no, I'm not. And guess what? There was mold over all the drywall in the basement. I like where that because it was like a bathroom going down to a bathroom, and there was already mold formed, and it had been 24 hours, and we got it out. But it was just kind of a reminder, with all of these houses that, there's floods or hurricanes or standing water. And I'm like, that has to come out. I mean, unless it's plaster, which is like cement basically, it's gonna have mold there, and then you're gonna get those VOCs and mycotoxins, and all the badness. So, and then what that does is it really messes with your immune system and hurts your gut health, makes you more susceptible to different autoimmune diseases. So anyway, I really enjoy talking about mold because I feel like it's not talked about enough, and a lot of people suffer from it. But peptides are really helpful with mold. They are a really good tool in the toolbox if you're working with mold patients, or if you are a mold patient.
Yeah. So it goes without saying, if you have a mold issue, KPV can help, but you of course have to address the mold problem, as you were saying. You can't just take the KPV. I mean, I guess you can do that, but it's not going to have optimal benefits unless if you
Right.
get rid of the source of the mold, and assuming you have mycotoxins in your body, do things to detoxify them from your body as well.
Yeah, absolutely. And, it could be when you're just buying time, figuring out, are you still living in the mold, or was it an old exposure and you're colonized? And I have a lot of patients with that, where they just, first of all, they're waiting to get their house inspected or get an ERMI test or whatever they're going to do, or they just can't get out of it for a while. So that's where, yeah, things that help with inflammation will calm things down. So maybe your brain fog's better, binders supporting liver health, all those can be helpful, because it's pretty devastating for sure.
How about stealth infections too, like something like Lyme disease, Bartonella? Would the KPV also be beneficial?
Yeah, I would put that in the mix, because these patients are usually really inflamed. So you would use the thymus peptides, and then you could also add on, BPC 157, KVP. Those would be helpful. Other ones that are that are hard to get right now, CMAX and C-Link, they're going to help with like brain, so like brain fog and ADHD. Sometimes those are used for that. Biohacking, people use CMAX a lot just for neurocognitive health. Those are nasal, but once again, those are harder to find now. So we have to be a little bit patient, but sometimes those are also used with these patients if they have the really bad brain fog. They're nice to use.
Curious, any peptides that can help with stress, adrenals? Obviously, you got to block out time for stress management, incorporate improve your stress handling. But any support specifically for adrenals when it comes to peptides, or anything that you would recommend? Maybe not directly supporting adrenals, but peptides that could help.
Yeah, well, for stress, you could use different peptides that, like the CMAX, C-Lank. There's, it's not really a peptide considered. Well, maybe it is DHHP, which is from the magnolia bark tree, and it's really good for calming like anxiety. It's almost like a Xanax like derivative, like similar like action. I've had patients say that to me. So DDHP, I like that one a lot. One that's really cool that's an oral peptide is 5-amino-1-MQ. And because it's a mitochondrial peptide, it really helps with energy and mood. So I would think that would be a good one because it's working on all the mitochondria. So I would think that would help the adrenals too. I have patients that really love that peptide, and I have them stay on it for a few months, and then I'm like, let's take a break for a month, and then you could go back on it, which, maybe I'm being a little bit conservative with that because it's just a mitochondrial peptide. So it's increasing AMP-K, it's boosting energy to all of the cells. So it's helping with that cellular energy and the pathway that we get our energy. And that one, you could take up to 3 times a day. Usually I tell patients like 1 to 2 because you don't want to take it too late in the day because it can be more stimulating. Also has a little bit of thermogenesis effect, so weight loss and lipolysis. So I like that one a lot for patients. That one though, like I would say like 10% of patients like just they don't like it or they don't notice it does anything, but all the rest of my patients really love it. And I'll use that one when I'm traveling more, if I'm going across time zones or something instead of coffee, and I'll use that just to support my body. So I would say that one's the closest in the peptide world. For the adrenals, one thing that you could do is go on a bioregulator for the adrenals. So a bioregulator would be a good choice for the adrenals. And thyroid patients for bioregulators, which are those 4 or less amino acids. Bioregulators are basically purified amino acids from animals, and they're purified down, and then they put them in a capsule. You take the capsule, and same thing as peptides, going in, turning on and turning off genes. And bioregulators came from Russia. Dr. Kavitzin did most of the studies for that, started out doing studies on the Russian Navy because they were going away to war and they were just coming back very ill, like not looking well. So they started using bioregulators on them. Great safety profile. They're being used more and more for longevity. And I really like using the Thyrogen, which is the thyroid bioregulator. And then I usually do pair that with an adrenal bioregulator. And as we know, the thyroid and adrenals really play off of each other. So it's really great for patients. Maybe if they're just on the verge, their thyroid just needs a little bit more help, a little bit more reserve. I also use it for patients that have Graves and that have Hashimoto's, because bioregulators, they're not a stimulant. They're not going in there and like revving things up. They're going in there and repairing those genes. So that's a great one. I love bioregulators. And the awesome news is towards the end of May, June, we're going to be able to get bioregulators a little bit easier because they've been really hit or miss because of supply chain, because of what's going on in Russia and Ukraine. So it's really exciting that they're actually going to be available because it's been so hit or miss the last year. It's been a little bit frustrating for me and patients. It's like, I want you on these bioregulators, but we can't get them right now. And they're like out of stock everywhere. So for adrenals, I would definitely try the bioregulator. And of course, we want to remember the other tools in our toolbox, like making sure you're getting good sleep, turning off blue light at night, making sure you're eating well, balance the blood sugar. And also, we can't forget adaptogens. And adaptogens are just so great for our adrenal glands.
Yeah, definitely agree with you there. With the bioregulators, they're also administered orally?
Yes, yes, that's the great thing. They are administered orally and they get absorbed really well because they're so little. So they just like cross right over and your body doesn't even have to digest them or anything. So I'm a big fan of bioregulators.
And you might have mentioned this earlier, but I'll ask just because I didn't. I guess with peptides and bioregulators, when you take them, so if you take injectables, it sounds like you need a prescription. If they're oral, does that mean you don't need a prescription then?
So yes and no. So things are changing. So I most peptides I will do prescription and get them from a compounding pharmacy. There are oral ones out like the TB4 Freg and the thymogen that you can get as nutraceuticals as supplements. Some of the companies you can just buy them, and some you need to buy through a healthcare provider. So, the big thing with that is similar to supplements, you're really going to want to make sure that you are going to high quality sources. You don't want to just get them from wherever. And now with the injectables, what has happened, people can't get them anymore from the compounding pharmacy. So there's a few other countries, or there's China or Russia, and they're ordering these vials. And you don't know what you're getting. You want to make sure the company has certificate of analysis, that they're testing batches. This is the stuff that the compounding pharmacy does to make sure you're getting what you're really getting. And when we talk about peptides, I guess we should talk about the weight loss peptides, semaglutide, tirzepatide, which is Ozempic, Manjaro, Zepbound, all the different names, and Wegovy. Yeah, that's another one. And these are just there's like every compounder is making these, and you want to make sure you're getting it from a high quality place. They're testing the batches, because you're injecting this into your body, and we don't want to inject things that shouldn't be there, because peptides they're good things, but you need to make sure you're getting them from quality sources, similar to supplements. But I can dive in just a little bit to those GLP-1 agonist, GIP peptides, because you can't like turn on your phone without getting an advertisement for them, right? I mean,
Yeah. Well,
yeah, someone just messaged my friend texted me and she said Costco is now offering these GLP-1s. You can do an
oh wow.
online visit and then pick it up at Costco. What do you think about these? I'm curious what your thoughts are. People are really like one way or the other about these, I find.
Yeah. I didn't. Well, first of all, I didn't know that. I do have a Costco membership, but did not know that you could get peptides through them. I guess certain ones like GLP-1 probably can't get BPC 157
No,
through
no,
Costco,
just
but
these. Yeah, just these.
yeah, I guess when it comes to like weight loss peptides, it sounds again, I don't have keep in mind, I'm not as of now recording, not recommending them to my patients. So I guess it sounds too good to be true. Again, you're the expert. So I imagine just like you mentioned with the other peptides, you got to also it's not just a matter of taking the peptides and losing weight, correct? You need to eat a healthy diet, manage your stress, get sufficient sleep. So if you just take them alone, maybe they do help to some extent, but if you combine them with a healthy diet and lifestyle, I imagine they work even better.
Yeah, and this is the thing, first we don't want to do any harm, and then I want to cycle peptides still, right? I don't want to just put the gas on, this pathway all the time. And there are natural GLP-1 you know, things that we can do. Berberine is a slight GLP-1 agonist. Anchormansia is a slight GLP-1 agonist. I mean, which is a gut bacteria. There's different things that activate this pathway. So what the peptides do, it's an injectable. You're activating that pathway, that GLP-1 agonist. You're going to be feeling fuller longer. It slows down gastric emptying. It also it does have an effect on the brain. We know it affects that brain pathway, and it's going to be helping your body secrete more insulin, and it's also going to stabilize that blood sugar a little bit more. It really has a good place. I've had patients, and I've been using GLP-1s before, all the celebrities were. I've been using them with my patients, in select patients. So what do we do first? We work on their habits that we talked about, all the sleep and nutrition and all of that. We fix their gut health, we balance their hormones, we balance their thyroids. And sometimes I have them wear a continuous glucose monitor, and we really try to do things before the peptides, but sometimes they're doing all the things and they just need a little bit of help for a few months. Most of my patients are just on the semaglutide or tirzepatide just for a few months. Now, I tell them, when you're going on this, you need to eat enough protein and you need to be lifting weights, because one of the side effects is muscle loss. And once you hit 40, you lose 1 to 2% of your muscle mass a year. You can. So you really have to fight that, because it's harder to gain muscle too when you get in your 40s, 50s, 60s, 70s. So that's one thing that, we don't want to do harm first. So I really tell them, we have to make sure you're maintaining muscle, you're eating protein, and they're staying hydrated. Now, one thing that can happen is patients will go to a med spa or something and go on these shots, and they're dosed really high right away. So they're super nauseous. So they can't even drink water. They're throwing up. They go into kidney failure, or they have kidney damage. So we don't want that. It's nice to get it compounded, because you can titrate up really slowly, as opposed to just, the dosing that the pharmacy has. So right now, the compounding pharmacies are still allowed to compound this medication because it's on back order in so many places, because it's just exploded. So I think, I don't think people should just be on semaglutide and tirzepatide 24/7, 365, and then not change their actual habits, because then when they get off of them, they gain the weight back. Their blood pressure goes up. Their cholesterol and triglycerides go up again. And we know this from the actual studies. There's so many studies that show this again and again. And part of that, the drug company is saying, look, you got to stay on this forever. Insurance companies, you got to pay for this for forever for patients. And yes, maybe in a type 2 diabetic, that isn't going to change their lifestyle. But I don't think that's good either. I think that they should really weave in lifestyle to that. And a lot of the times when someone's on a GLP-1 and a GLP-1 GIP, which is tirzepatide, we can put them on something like tesamorelin, ceramorelin, which is a growth hormone releasing hormone. And that could help them with that building the muscle. So those are a group of peptides. They're not growth hormone. They're growth hormone releasing hormone. So they tell your body to release more growth hormone, because as we age, our growth hormone goes down. Now, one thing with these peptides, you do want to make sure there's no active tumors. You want to check IGF-1 levels and make sure they're not too high. But these are great peptides that can really help like boost muscle mass. I have a patient that I did that was a mold patient, and then post vaccine injury combined, it kind of triggered the mold. Anyway, he lost so much muscle mass, was so weak. And after we treated the mold, I was like, how do you feel about going on a growth hormone releasing hormone? Let's get some of your muscle mass back up, because he was in his 50s. And that's really important to his health, to have muscle, right? And for his hormones. So he was good with it, and he really did well on it. We just had him on it for a few months. It really got some of his strength back, got him motivated, and he just kept improving from there. So this is why peptides are so beautiful, because we live in such a toxic soup bowl, and there's so many things that we have to heal from that no one had to worry about like 50 years ago, right? And they could really just pair nicely with integrative functional treatments, just to elevate and get patients better faster. So it's really fun.
Yeah, they do sound amazing. So one other question I have for you is, do you take any on a wellness basis? Like if someone is in a relatively good state of health? I mean, I think you said you take some peptides early, which isn't a surprise since
Yeah.
since you're
Yeah.
the peptide expert.
Yeah, well, it's really fun to like biohack and like the growth hormone secreting hormones. I did that for a while. I sleep really well on them. I just took a break though. Maybe I'll start that back up this month. I don't know. But I sleep really well when I'm on there. But and that's something you cycle 5 days on, 2 days off. So I'd usually do Monday through Friday and then take the weekend off. But those are a lot of fun. One peptide I didn't talk about yet is GHK copper peptide. I mentioned it for like a second with wound healing. So this one, I have never taken this one injectable. I've heard it's amazing. That is another one that was on that list. So I'll just talk about the topical, which you can still get compounded and you can get over the counter too. So GHK copper peptides, it's another peptide made in our body. This does decline as we age, and I love it for skin. So this is something that I use on my skin every day. I love it. Helps with fine lines, wrinkles. It really supports that outer skin layer. So, your skin's not going to get as dry. Helps with redness. I put a lot of, while I'm working on their gut health too, because we know rosacea is gut health. I put patients that have rosacea on the copper peptide cream, and they've like thrown away like 4 prescription bottles from their dermatologist of just junk, like that's just crap what they give their patients. And they use the copper peptides and they're like, wow, this works better than all of those prescriptions. And I'm like, yeah, isn't that crazy? Not really. But anyway, so that one's great, helps with crepey skin. So such a fun peptide. Really good with wound healing. This is something that it was funny. Well, it wasn't funny because I was mad at my son, but he got sunburned when we were in Mexico for spring break, and I had my copper peptide serum for my face, and I was putting them on his sunburn because it actually does help with DNA. So DNA damage, UV protection, and it's kind of crazy. There's a study they did on GHK copper, and it affects either upregulates or downregulates more than 50% of up or down regulation of basically a third of our genes, 32% of our genes. So this is a peptide that is going in there and affecting almost a third of our genes. It's really cool. And I really love that one. If you dig into the research with GHK copper, really cool things they were doing in rat studies with hemorrhagic stroke, like reversing symptoms, like amazing, crazy cool studies. And I wish that they would keep on studying this. So we'll see. I don't know where that peptide's going to end up. I think it could do beautiful things, but I don't know what the FDA wants to do with it. I wish I knew, but that's a great one topically if you're not using it topically. Now this is different. Some people will be like, oh, I have peptides in my skincare. No, you probably have like these weak collagen peptides, which whatever. This is GHK copper. And there's a couple of good, if you guys go to my website or Instagram, there's a bunch of companies I love for that. Another peptide that I actually just learned about a few months ago, and I take it every day. It's a plant-derived peptide. So there's this company called Nutravuz, and they use AI technology to find plant peptides and find different peptides. It's a company in Ireland. Such cool stuff they're doing, and they're rolling out like 1 to 2 new peptides a year, but they do clinical studies, human studies on these peptides. So this is like so cool. I like geek out. I get so excited about it. And the one, it's called Pepti Strong, and it increases muscle synthesis. It supports mTOR, and it also affects myostatin. So you're not getting that soreness post workout. So this one, I take it like in like a blend. I take it oral capsule. You need 2.4 grams of it orally to stimulate the muscle synthesis, and it helps basically like retain muscle. So the studies they did were on patients where they like immobilized a knee, and they did muscle biopsies, and the patients taking the Pepti Strong maintained more muscle and muscle mass while they were immobilized than the controls. Also, it showed it was helping with osteoporosis and increasing bone density. So this is something that my patients taking a GLP-1, I'm offering and recommending for them to take this and lift weights and eat protein. And then also my postmenopausal women, I want them to take this new Pepti Strong. And they're talking about cool stuff with this, like putting this in soup at nursing homes to, you know, help with keeping that muscle, because we know muscle, it's a longevity organ. It helps with insulin sensitivity. It, you need to be able to lift yourself up the toilet and all of that stuff. It, decrease falls. So really cool stuff. So I'm really excited about that one, and that's something I take every day. BPC 157, like I said, on and off. It's rare for me to get stomach issues, but when we did go on vacation, I came back and I don't know if I got gluten bombed or something that last day, but my stomach was a mess. And I'm like, this is so weird for me. I'm not used to this. So I took some peptides, and within 24 hours of some peptides and then some supplements also, I was fine. So I like to keep it all handy. What else do I have in my fridge? I'm trying to think. Well, the BPC 157 injectable, I do have that still because I got it before, we got it before the FDA said no more. So I have that for when I have a little bit of tweaks and injuries. I was actually thinking about putting a little bit more in my shoulder to get it a little bit stronger. So those are the peptides I take right now. I definitely think it's fun to try them, and I always like to try things before suggesting to my patients if I can, but some things I just don't need, but there's so many great things out there. Are there any peptides that you like want to try now after we were
Oh
talking?
yeah. Oh yeah. Just
What's first on your list?
well, I mean, you mentioned the Pepti Strong just because I've been over, especially over the last year. I mean, I've been working out for a long time and lifting weights, but really haven't gone heavy until like the last year. Really just been focusing more on muscle mass, and actually hired a personal trainer, both myself and my wife. So yeah, the Pepti Strong, I was like, yeah, I might want to take that for a few months, because you said you take that every day, but is that still something you'd cycle, like take like 2 or 3 months and then take a break for a month or two?
Right. This one, I spoke with the creator of it. Well, at the Peptide Summit, which we'll talk about, I talked to him, and he said you didn't have to cycle this one. So I probably still would just take a break from it, maybe for a week or two, depending.
Yeah.
But yeah, I mean, it's the plant-based peptides coming out. It's pretty cool. It's really exciting because it's a nutraceutical. It's a supplement. So we're good. We're good to, we're good to weave them into our protocols.
Yeah, no, this is awesome. I learned so much. I'm sure the listeners learns a lot. Definitely has motivated me to try peptides, and
Yeah.
eventually also recommend them too. But uh, before we wrap things up, and definitely want you to talk about your summit a little bit. Um, Anything else? I mean, you shared so much information. So any last words? Anything else you want to say?
Yeah, with peptides, I would definitely say make sure you're working with someone that knows how to use peptides and when to use them, because you don't want to waste your time and your money. And there is just kind of like an art to using peptides, and that comes with experience of using them on patients. And they, most of them, like I said, very safe, safety profile, and that's something that's really exciting. And there's a lot of oral peptides now, which is also really exciting.
Yeah, quality. I mean, like you said, with supplements, it's important. peptides just as important. And again, the expense, like you said, you want to make sure you're safe, even though that's another thing we didn't really talk about, the contraindications, but you mentioned earlier that they are relatively safe, correct?
Yes, yes.
Yeah. So, but yeah, so definitely work with someone like Dr. Jen, who has a good amount of experience with peptides, definitely more experience than myself. And yeah, you just blew me away with the knowledge you have. And so, yeah,
Oh,
let's,
thanks.
yeah, if you could, just tell people where they could find out more about you, your website, tell them again about your podcast. And of course, if you could talk a little bit about this upcoming summit.
Yes, awesome. Thank you, Eric. So basically, the best social media where I hang out is Instagram, and my handle is Integrative Dr. Mom. So Integrative Dr. Mom. I have a YouTube that is the same handle. My podcast is the Integrative Health Podcast with Dr. Jen. And my website is Healthy by Dr. Jen. That is my main one for health coaching, is the Healthy by Dr. Jen. I have a brick and mortar called Pfleghaar, and that is, that's just in Northwest Ohio. So really the Healthy by Dr. Jen has a lot of blogs and everything. And the end of May, so it's May 21st, starts the Peptide Summit. This is with Dr. Talks, and you can Dr. Eric will give you the link. I'm sure he'll link. And if you guys are subscribed to his newsletter, he's going to send out some information. But you sign up for that. It is free to attend. And you will be blown away by the experts there in peptides. It is amazing. You will learn about more than you'd want to know about peptides, and a lot about longevity and biohacking. So it's really fun. It's such a fun summit, and you're just going to learn from the experts. Some of the names we have on there are amazing, and I had so much fun at each interview and learned so much. And I know if you guys enjoyed this podcast, you'll really enjoy the summit.
Yeah, I look forward to learning more, because I'm gonna also make sure to register for it and check out the talks. And yeah, again, thank you so much. This was really amazing. Like I said, I learned a lot. I'm sure the listeners learned a lot, and appreciate you taking the time to talk about peptides, Dr. Jen.
Yes, of course. Thank you so much for having me.